Traditional cancer chemotherapy is not specific. It attacks all dividing cells. Because cancer cells divide quickly, they're more susceptible to chemotherapy than normal cells. But most normal cells do divide at some point and may be affected by chemo. Newer targeted anti-cancer agents, including many hormonal therapies, were developed to be more specific. They're designed to block individual proteins or hormones that help cancer cells survive and multiply. But cancers can learn how to work around the block setup by targeted agents, and some of the hormones and proteins these therapies target may not be unique to tumor cells. Tumor-specific immunotherapy is designed to work differently by empowering the immune system to seek out and attack each patient's tumor cells. The first step in developing tumor-specific immunotherapy is isolating a protein called a tumor antigen that's found primarily on cancer cells and typically not on normal cells. There are different ways a tumor antigen can be transformed into immunotherapy and delivered to the patient to help fight their cancer. In cancer, the effects of drug therapy may begin to diminish when treatment is complete and there is no more medication in the patient's system. Some cancer cells may remain after drug therapy and become the source of local recurrences and metastases. Immunotherapy is designed to work differently. It harnesses the patient's immune system, which may help continue killing cancer cells long after immunotherapy treatment is completed. The immune system has many cell types, each with different jobs. Here's how immunotherapy stimulates an immune response that targets cancer cells with specific features, namely specific types of proteins called tumor antigens. Immunotherapy works by activating two types of immune cells, T cells and B cells, to recognize these antigens so that they can go on to recruit other cancer-killing immune cells. Activated T cells are involved in the initial attack on the cancer cells that have that tumor antigen. Activated T and B cells learn to recognize this tumor antigen to help the immune system develop a memory, so that it may help provide longer-term protection against recurrence of tumor cells with that antigen. Long after immunotherapy treatment itself is completed, memory cells may remain in tissues throughout the body. If they encounter cancer cells bearing that tumor antigen, memory cells may launch another attack to help fight recurrence. This is one way immunotherapy can be durable. It empowers the immune system to continue recognizing and fighting cancer over time. Targeted anti-cancer agents can be effective, but not all of the cancer cells may be susceptible. In other words, they may not have that target. Not all cancer cells in a tumor are 100% alike. When a tumor is treated with a targeted anti-cancer agent, susceptible cells are killed, but other resistant cells may survive. If these resistant cells multiply, a tumor may develop that is resistant to that agent. Immunotherapy can be different. The initial attack on the tumor includes a variety of different immune cells. Some of the cells are programmed to target the specific protein, the tumor antigen. When they encounter cancer cells with that antigen, the immune cells attack the cell to destroy it. Whenever a cancer cell is destroyed, it releases more tumor antigens. Many of these antigens will be different than the original antigen targeted by the immunotherapy. These different antigens will be picked up by other immune cells present, leading to reprogramming of the immune system. This helps the immune system learn to target the cancer cells that have these antigens. Specifically, the circulating antigen-presenting cells will identify the antigens to then recruit and activate a totally new set of T cells and B cells. These immune cells may now be able to attack cancer cells bearing the different antigens. This process is called antigen spread. In this way, immunotherapy works differently. It's designed to support the immune system's ability to adapt and kill cancer cells as the disease mutates over time. Immunotherapy, empowering your immune system to fight cancer by being specific, durable, and adaptable.
Indication: Provenge, Sapulus LT, is a prescription medicine used to treat certain men with advanced prostate cancer. Provenge is an established cellular immunotherapy and is customized to each individual by using his own immune cells. Important safety information. Before receiving Provenge, tell your doctor about any medical conditions, including heart or lung problems, or if you have had a stroke. Tell your doctor about any medicines you take, including prescription and non-prescription drugs, vitamins, or dietary supplements. The most common side effects of Provenge include chills, fatigue, fever, back pain, nausea, joint ache, and headache. These are not all the possible side effects of Provenge treatment. Provenge is made from your own immune cells, which are collected during a process called leukapheresis. The cells are processed, returned, and then infused back into the patient through an IV, intravenous infusion, approximately 3 days later. This process is completed in 3 cycles about 2 weeks apart. Each infusion takes approximately 1 hour and requires 30 minutes of post-infusion monitoring. Provenge infusion can cause serious reactions. Tell your doctor right away if you have signs of a heart attack or lung problems, such as trouble breathing, chest pains, racing or irregular heartbeats, high or low blood pressure, dizziness, fainting, nausea, or vomiting. Have signs of a stroke, such as numbness or weakness on one side of the body, decreased vision in one eye, or difficulty speaking. Develop symptoms of thrombosis, which may include pain and/or swelling of an arm or leg with warmth over the affected area, discoloration of an arm or leg, shortness of breath, chest pain that worsens on deep breathing. Have signs of an infection, such as a fever over 100 degrees Fahrenheit, redness or pain at the infusion or collection sites. Tell your doctor about any side effects that concern you or do not go away. For more information, talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying full prescribing information.